All right, Dr. V, I think we are just going to get this thing started right now. And you can still hear me okay?
You're coming through.
Awesome. So if anybody can't hear me, please put something in the Q&A chat. We were having some volume issues before, but I think we're good to go now. So it's a little bit after 6 o'clock. I think we're going to go ahead and get this thing started. For those of you who don't know me, my name is Brenna Leftwich. I am an academic and industry relations manager with Aspen Dental Management, Inc., also known as ADMI. I've been with the company about 2.5 years now, working with dental schools and dental students from the Midwest all the way to the West Coast. I am located in Arizona, so a few of you guys might recognize me. I've spent quite a bit of time at your school. So I'm really happy to be here. As you can see, I am joined with Dr. Victor Veillon. I'm going to have him introduce himself here in a moment. First, I just want to let you guys know that I do have all the questions that you guys have submitted in advance are on a screen over here to my right. So if you see me going back and forth here, just know there's nothing more exciting going on over here. I am paying attention, just going through all the questions that you guys have and keeping this organized for everybody. We also have a live Q&A. So if you guys have any questions throughout this whole thing, please throw them in the Q&A. It should be at the bottom of your screen. You can also submit them anonymously as well if you would like to do so. I think that's about all I have. So Dr. Veillon, would you like to introduce yourself?
Hey guys, thanks for having me. A little about myself. So from Arizona, actually went to school in Indiana. So graduated from IUSD. Ended up coming back to Arizona where I began my career not with Aspen but with a public health practice, and then eventually transitioned to Aspen. I've been here a little over 2 years now. Started as an associate. I'm now the MCD here, which is the managing clinical dentist, fancy way of saying the lead dentist here at Aspen, and then I am also in Arizona. So I'm at the Mesa Riverview location, not too far from where you guys are. So yeah, that's a little about myself.
Awesome, thank you. And we might have another doctor hop in the middle here. She's supposed to join us. Her office hours are running a little bit late tonight. So if you see somebody else pop in, that's Dr. Zark, and we'll have her introduce herself if she makes it on. So we'll see, fingers crossed. But again, thanks everybody for joining. Thanks Dr. Veillon for hopping on tonight. We're also excited to have you. I think it's awesome we have an Arizona doctor on for our Arizona audience. This is an Ask Me Anything session, guys. So ask us anything, easy questions, hard questions, anything that pops in your head, that's what we're here for. Again, throw it in the live Q&A chat at the bottom. But for now, I think I'm going to go through some of the questions that you guys have submitted in advance. So we'll start off there. Oh my goodness, actually, Dr. Van, somebody just wrote, this is a fun first question. Forks up or bear down? That's funny.
Bear down. I like it. It's like I went to UVA, so you know, yeah, I'm Wildcats all the way.
Wow, you're probably
turn some
off before we even get started here. Probably a nice divided audience, so it's funny. Okay, so we'll really start this off here with why did you choose Aspen Dental? So I know you talked a little bit about your background, but if you want to talk about like from when you graduated school, where you started, how you ended up with Aspen, and why you made your choice.
Yeah, so that's a great question, right? Like I said, I went to school in Indiana, but from here, you know, I kind of ended up coming back home. Initially started with a public health company, but I wasn't getting the experience I really wanted, right? And so it was a great opportunity, but for my long-term plans and the growth I wanted, I really wasn't getting that there. So I started looking at, you know, a few different places, and then anytime you're looking for a job, right, you're going to see what's out there. You're going to check, you know, the private practices, you know, the DSOs, stuff like that. And, you know, Aspen was one of the ones that I came across. So in doing like, you know, the due diligence, you ask around, you try to get the pros and cons of, you know, going one route versus the other. I had a little bit of experience in, you know, that public health field that wasn't doing it for me. So it kind of brought me back to, hey, do we want to go the private practice route or do we want to go, the DSO route? And then in those interviews and just conversations with friends, we're talking a year after graduating, so there's colleagues and stuff that can give you a little bit of insight about, their experiences, but you start to hear the pros and cons. And so a big thing for me when I was just looking at where I would take my next step was, experience and kind of the mentorship. And so those are two things that just drew me to Aspen, because, you hear a lot of stories about, the private practice and just getting kind of cornered into a certain type of dentistry. And I wanted to be able to experience it all. And I knew that, through conversations with other people, I was going to get the opportunity to, do extractions, do crowns, do just a whole range of stuff where I wouldn't just be stuck doing like fillings or anything like that. So that was a huge motivating factor for me. And then the other thing was that, I was pretty new. So I didn't have that confidence, right? I didn't have the greatest experience coming out in that first job. And I wanted someone to kind of be there for guidance. And it's a huge, just load off your shoulders when you've got help, when you've got someone to go to kind of direct you a certain way. Because coming out of school, you're not going to know anything, right? So you've got, the theoretical practice of what you've learned. You've got what you've done in clinic and, the limited scope that you've got actually working on patients at the school. But you don't know it all. And, the first, month in practice, you guys are going to find out, like, there's a lot that you're going to learn just like that. And to have somebody to act as a sounding board and as kind of another voice of reason is huge. And having those two at the top of my list, it was a no-brainer to come on board.
Mm-hmm. Yeah, thank you. And you brought up a lot of great points that we're definitely going to go through throughout this webinar. I think a really big one is mentorship, especially having an audience of dental students. So I'm glad you brought that up. That's definitely something we'll dive into a little bit more as our mentorship program. But first I want to say, so we keep using the term like DSO. So I think I'll start us off also by, would you like to elaborate on what a DSO actually is?
Yeah, so it's a dental service organization. It's an organization that, provides dentistry, but also has, a second component. It's like having two arms. There's the clinical portion, and then there's everything on the back end. And there is a lot on the back end. So when, I say DSO, that's what I'm talking about. And there are a lot of organizations out there, right? Aspen is not the only DSO, but the setup is kind of similar. It's, having a clinical portion to seeing patients and then all the other business related stuff. So anything from, hiring and doing the HR to having someone to field calls to get someone on the schedule. So it's a group and a team that works, to kind of promote the office and do what we need for the patient. So that's, in a nutshell what it is.
Yeah, definitely. That was a great answer to that. I mean, like, it is a dental service organization, or another term is dental support organization. And that's exactly what it is. It provides support for you in your dental practice. And I mean, we do that with over 800 offices we have now within the Aspen Dental Network. So we are providing support to so many different doctors across the country. And as Dr. Ban would say, you guys have 100% clinical autonomy. We're just there to support you and have you guys be honestly the best doctors that you can possibly be by focusing on the dentistry and not having to worry so much about all the non-clinical aspects of it, I guess you could say. So still on the topic of DSOs, how would you say Aspen Dental differentiates itself from other DSOs within the industry?
Yeah, so like I said, there are a lot of DSOs out there, right? So each one kind of has different formats and they're set up, differently. But with Aspen, being one of the bigger DSOs, there's just so much more that is taken off of your plate, right? So Brenda kind of nailed it on the head, right? The support you get it's ridiculous. It really allows you to, focus on the dental part of it and kind of, hone in on your skills there and not have to worry about the other stuff. Now, that doesn't mean you can't worry about the other stuff, right? There's, a lot of involvement that you can get yourself into as you're joining Aspen. And I think that's one of the things that puts us, aside from all the others, right? You've got opportunities, in clinic, you've got support opportunities outside to, do what I'm doing now, talk to new grads. There's a few kind of offices throughout the country that, have focuses in different areas. And, there's just a lot of opportunity. We're a growing company. And, especially with kind of the changes that we've gone through recently with, COVID and all that stuff, having the huge level of support is definitely kind of a thing that puts us aside from everyone else.
Mm-hmm. So we did have a follow-up question to that, which was, so I think you just answered how we differentiate ourselves from other DSOs or dental support organizations. What about private practice? So what would you say is the biggest difference between our organization compared to a private practice?
Yeah, so each private practice is going to be different, right? So you've got to keep that in mind. I think one of the biggest things that I've taken away is my ability to just kind of get in and do dentistry the way that I would like to, right? So we talk about those motivating factors for me at the beginning, and experience was a huge part of that. And I didn't want to be told kind of what I could do, what I couldn't do. And for me, the stories I've heard with private practice were that you do have kind of limits on what you've got, right? So when you're dealing with kind of a smaller office and a smaller organization, then a lot of my friends were kind of getting, they're kind of getting the scraps of what was coming through the office, right? So you get big cases and, stuff that's really fun to do that you want to get into. And then in some of these smaller offices, you're getting a lead doctor that kind of takes care of all that stuff because that's their practice. And, they, rightly so, they want to kind of keep the reins on everything, but they're just divvying everything else to the associate. And that's one of my biggest complaints that I've seen in private practice, is just not having the ability to expand what you've learned, in school and what you actually get to put into practice on an everyday level. So that's a huge thing that I constantly hear from private practice when you're making that comparison to a DSO.
Yeah, I mean, I definitely hear that quite a bit as well. And I think that I can definitely tie that into the compensation model that we're going to talk about a little bit, and how the way our compensation is structured, it kind of ties into the team aspect of the office, and the way that the lead doctor is almost incentivized to train their associate, which I think is kind of the big issue in private practice when you have a lead doctor who is paid off of sole production. Of course, they're going to keep you the bigger cases. That's more money in their pocket. So it kind of hinders your learning opportunity as an associate. So we can dive into that a little bit more when we talk about compensation. So I think one last question on the topic of DSOs is one more question. What have you found is the biggest benefit of working for a DSO?
So again, for me, and that might be different for everyone else, for me, it's, one, the experience, and two, the support. Because again, when you guys get out, you guys are going to see how much work goes into, running a practice, right? from staffing to insurance to, like, building secured for an office. There is so much that goes into just running a practice well, and you just don't have to worry about it, right? And that's huge, because not everyone wants to do that when they come out, right? Not everyone wants to tackle these huge roles and these huge responsibilities when you're just trying to figure out, what do I like about dentistry? What am I good at? What's piquing my interest, right? There's so much that you've got to explore about yourself when you're first out that, that support is enormous, right? And the more you can take off your shoulders so you can discover yourself as a clinician, I think the better you'll be in the long term. So that was big for me, just support.
Mm-hmm. And I'll add on to that by saying, like, what's so cool about it is you can be as involved as you want to be. Like, there's no one set model or structure or anything. Like, we have so many doctors. I mean, there's some that want to be involved in every aspect of the practice, business related and obviously clinically related. And we have others that have, they really trust their office managers, their regional managers to take on that role for them. So that's really something that's going to be up to you. Again, you can be just as involved as you want to be within the practice. So I think we'll move on here to a little another topic. Another question we had submitted was, what is the clinical autonomy like as an associate versus a practice owner?
So it's pretty similar, actually, right? So let's talk about, like, the structure in an office, right? Because each individual Aspen that you see is owned by a doctor. So there's an overall owner. And so when I hear this question, that's what I think. It's like, all right, versus, the person who owns the building, what do they get to do that you don't get to do? And then let's break it down even further. Like, so for me, I'm the MCD that I mentioned earlier. So I'm the lead dentist in my office. And then after that, we've got the associate. So you've got kind of 3 levels between just one building, one office. And I would say there's not really much of a difference between what you say, what can you do? You can do anything, really, right? There's, you have to get to a certain level where you're comfortable doing things. Mm-hmm. And if you want that and you push yourself to do that, then you're going to be able to do the same things that the owner does, right? Coming out of dental school, you're not going to be comfortable, necessarily, just laying flaps and doing full mouth extractions and stuff like that. Maybe you are, right? That depends on the person, but there comes a point where you're going to get comfortable doing things, and then you're going to be able to do the same things that the lead dentist does or the owner doctor does. So I wouldn't say that your autonomy is any different than anyone else when we talk about those 3 different levels.
Mm-hmm. Yeah, I get asked similar questions to that quite a bit when I do, lunch and learns and presentations within schools. And I always say it's so dependent on you and, your confidence level and your skill level. Like, whatever you are comfortable doing, you have the ability to do within the practice. Like, there's no structure like, oh, associates can only do this, lead doctors can only do this. If you're comfortable doing it and you're confident and you can do it, and the owner of the practice or the lead doctor trust you to be able to do that, then you're going to be able to do that. That's kind of the response I always have.
You're going to get a lot of support, right? Because it's good for everybody when you're able to expand and you're able to increase your skill set, do more challenging cases, and do the things that you want to do. Like, it's good for the office, it's good for you as far as personal growth. So there's a huge amount of benefit to that.
Mm-hmm. So we'll stay on the topic of, the office structure right now. So someone wants to know, how many doctors are in each of our practices?
So that depends, right? So you've got some places, have one doctor, some have two. It just depends on the size of the office, and that's going to also dictate, not just the doctors, but your hygiene and your dental assistants. So, for instance, in my office, we've got one doctor. I'm the doctor here, and then we're bringing on an associate here in the near future. But if you go to any of the Arizona offices, you're going to see multiple doctors at each of them. So it depends what makes sense for that market, that demographic, because if the volume is there to support a need for it, then we're going to bring on, however many we need to meet the demands in the market. So I'd say in Arizona, right now, you're going to see a lot of offices with two, but you still see some, with one. But again, it just depends on the office. And again, hygienists, same thing, right? So you've got some offices that have a really heavy hygiene need, and so you'll see two hygienists in there. You'll see some of those offices with two doctors have a lot more dental assistants than you'd see in one with one doctor, and it just depends on, the needs of that particular location.
Mm-hmm. Yeah, and I would definitely say, I would say on average, most of the offices typically go on a two-doctor model, having a lead doctor or MCD with an associate. But again, that is very dependent on the location and the patient flow within the practice. Like Dr. Van said, he is the only doctor in his practice right now, but he is going to have an associate pretty soon. So he'll be taking on a pretty fun role of mentoring somebody soon here. But a follow-up on that is, so how many dental assistants do you have in your office when you have just one doctor?
So we've got 3. I think Dr. Zolik's coming in right now.
Yes.
So we've got 3. We've actually have, a lead dental assistant, 2 others. We're bringing on more, but kind of touches on the same thing that, that we mentioned. What makes sense for that particular office? Do you need the staff? Do you, can you work with 2 assistants, 3 assistants? And so factors that go into that are, the number of patients you see, for instance, how many columns you're running. So at any given moment, we've got, patients that we're going to be seeing for, any restorative procedure. We've got new patients that we're being seen. We've got high needs patients. We've got, an overflow column for walk-ins. So how many people do you need to efficiently keep that schedule running? And for us, we've been able to do it with 3, pretty well so far. So that's where we're at. It's a good number so that you can have people kind of managing some of the flow of that office, but still have, you still have somebody that is going to be with you to help you through procedures, so you're not, doing stuff by yourself. Because that, again, when I was in school in Indiana, it's like we didn't have assistants. You're doing everything on your own. So, just having the ability to get someone with you all the time is huge. So, yeah, we've got 3, but it'll depend from office to office.
Mm-hmm. Dr. Zarek, hi. Do you want to introduce yourself? Thanks for joining us. It's all right if you need a minute.
I'm mute. There you go.
Oh wait, we still can't hear, doctor. It's all right. If you want to take a minute and figure that out, you can. I'll keep going. It's okay. I'll keep working on it with Dr. Bayon here. So we'll stay on the topic of the structure of the office while Dr. Zarek figures the volume out if we can. It's the fun of virtual events, right? Fun technical difficulties. That's just 2020 in a nutshell. But we'll go on to what are the office hours like? So what hours are you running in your office?
Okay, so that again, I mentioned this several times. It varies from office to office, but in my office, so we start, we're open for patients from 7:30 to 5:30, right? Every day we have a morning huddle to kind of set the tone, go over the schedule, stuff like that, kind of come up with a flow for the day. And so, that's usually 15 minutes early. And then 7:30 to 5:30 most days with an hour for lunch. There's a late day that we have every week. So for us, it's Tuesdays. For a lot of the other offices, it's Thursdays. And when we do the late days, it's just to be available for patients, right? Because not everybody can make it from 7:30 to 5:30. So having those evening hours, just even once a week, is huge for a lot of those patients. And those are the appointments get filled out and get booked, well in advance. So one of those days, that's 9 to 7. And then on Fridays, we have a little bit of a half day. So we're done at 1 o'clock on Fridays. We start a little later, 8 to 1. So it's nice to have that short day, still be available for patients 5 days a week so that you can treat them, but, you get a little extra time on the weekend when you're putting in the hours a little earlier in the week. We do work Saturdays, right? So when we talk about being available for patients and doing what's best for them, that's, again, some of those appointments that book out way in advance. Mm-hmm. So do 1 or 2 Saturdays a month, depending on the need, and then that sums it up. So
when you said,
what's that?
I was going to say, when you said you work Saturdays, I was like, do they have you working every Saturday?
No. We got some time off, right? But we're definitely in here to meet the need of the patients. And again, those night appointments and those weekend appointments. Those are the ones the patients really want, right? So when you are available for patients when other people aren't, then you're going to be able to help them out.
Mm-hmm. Yeah, I mean, I would say on average, most doctors are working like 1 Saturday a month, and the offices that have 2 doctors, usually they switch off Saturdays. So you would even be working like every other month 1 Saturday.
Yep, because you get some flexibility there where you've got coverage. Someone can be available just to see patients, and then you flex during the week. You get a day off when you're working the Saturdays. So it's managed, right? It's not just all at once. There's some flexibility.
Mm-hmm. Yeah, and what's nice about the 2-doctor model as well is a lot of times if there's a longer day, one shows up earlier and leaves earlier, and the other one can show up a little bit later and leave a little bit later.
Yeah, and it's not even with necessarily the 2-doctor model, right? So that's, I think, another huge benefit to Aspen, right, is that support, because you got to have support in your personal life. So I know that if I've got to work a Saturday, that I've got colleagues at, how many different offices around me that are going to be able to cover, or if I'm sick or something like that, we've got people that we can reach out to that can help out. So even though I might be the only doctor in the office, there's a network of people that are there for support that can help you out.
Mm-hmm. Yeah, I would say that's one of the biggest benefits of working for an organization is the network of clinicians and doctors that you have around you. I mean, I think we have somewhere like 14 or 16 offices in Arizona now, I think.
That's here alone.
Mm-hmm. Yeah, so I mean, like I said, a huge network of doctors that Dr. Bayan and everyone else can use as a resource. But a follow-up question to that was, how many patients are you seeing each day on average? And then another one was, what are the most common procedures that you're seeing in your practice?
Okay, good questions. So you're probably seeing, I want to say, around 20 patients on average. And keep in mind, and I know that's way different than the one patient that you see all day in dental school, but the flow of it is that you've got, different procedures that you're doing at once. So you've got your fillings that you'll see, extractions, crowns. You've got, the new patients that you're seeing. So anyone that's new to the office, you're going to see right there. You're going to see, denture adjustments and things like that. And so every day is different, right? Some days are slower than others. So you're not always going to see 20 people, but you figure out a system so that you can get in efficiently to each of those areas. So, even if a patient's coming in for an adjustment, that might be a pretty quick thing, right? So you can get that patient in, find out where their denture's hurting, you make an adjustment, and you spend, 5-10 minutes with the patient. And then that frees you up to go, do an extraction or, do a crown or things like that. So it varies, but if I had to put a number, like on an estimate, I'd say it's right around there, like right around 20 or something like that. What was the other part? There was 2 questions on that. What was the how many on average and
how many patients, and then your most common procedures?
Okay, so that's a good question too. With procedures, you do everything. And we talked about this before, you can do whatever you want. Like today, I had a veneer case that I did. You have implant cases. We can hear you.
At least we know the volume works.
I'm here.
There you are. Now we hear you loud and clear.
Yes.
Good. I had to switch to my phone.
You're good. We're excited that you're here.
Yeah.
So Dr. Brand, do you want to finish that, and then I'll have Dr. Zark introduce yourself?
Yeah, for sure. Welcome to the party, by the way. All right. So you're talking about just procedures that you do more often. Then we have a pretty healthy population of denture patients. So think of things that would go along with dentures, right? So a lot of extractions, denture, those denture steps, wax bites, denture adjustments, stuff like that. So you can do everything, and you will do everything. It just depends, what you push yourself to do. But I'd say a large portion of what we do is denture related. So you're going to do a lot of extractions, a lot of inserts, stuff like that.
Mm-hmm. Well, thank you for answering that. And so like I said, we're so excited Dr. Zark could join us. Would you like to introduce yourself? And then also, I'll go back to the first question that we had, which was, why did you join Aspen Dental? So if you want to take that.
Yeah. My name's Dr. Zarek. I work in Glendale at the Westgate location, and I'm originally from Illinois, and I moved out here about 5 years ago, and I love Arizona. The reason I chose Aspen is I was fresh out of school. I've been a practicing dentist for a little over 5 years now. And I knew I didn't want to own just yet. So I kind of wanted to get into the feel of dentistry. I've known some people to have good experiences with it. The thing I like is we have a lot of exposure to a lot of different procedures. And I feel like Aspen does a very good job. If you like doing things, they'll let you do it. Another thing too, when I graduated, is I had a lot of student debt, and that stunk a lot. And it still stinks to this point. And the thing with Aspen is I never really have to worry about money. We have a salary. So every day I come in, I'm getting paid plus a bonus. So those are some really cool perks to it too. It wasn't just strictly commission based. And lastly, I kind of want to work with other doctors, and there's a lot of doctors in the company, and there's a really good support system too. So we're attending CEs together. There's a lot of people you could reach out to. There's a lot of support too. And at the end of the day, I just like focusing on dentistry, which Aspen allows me to do. And if, with the private practice, you have to invest more in the business aspect. And me personally, I just want to focus on dentistry and then clock out at the end of the day. So those are some cool things I like about Aspen.
Mm-hmm. Awesome. Well, again, thank you for joining us. We hope your day wasn't too busy.
It was mostly just technical difficulties on my end. So.
Oh my goodness. Like I said before, that is just 2020 in a nutshell. But I guess we'll just jump right back into this with some of the questions that we've been going over. So to follow up on where we ended with Dr. Vayon, can you talk about how treatment planning goes in your practice? Yeah, we'll start there and then I'll follow up on that. So do you want to talk about the treatment planning?
Who do you want? Right here? I'll take that one. All right, so treatment planning, since I'm the only doctor in the office, I do all the treatment planning. So I'm seeing all the new patients, but we've got a flow for when the new patients do come in. So they're going to get, their x-rays taken, they're going to get the FMX, they're going to get a pano, they're going to see the hygienist. So it's huge to have the hygienist just helping you out, just with diagnosing, any of the perio stuff. And then you go in and you do what you think is best for the patient. So you have, again, we talk about choices that you can make, and you're the one that makes all the choices as far as treatment is concerned and everything like that. So it's your call. You pull the reins and you make the decision.
Dr. Zarek, anything to add on to that about treatment planning?
Exactly what he had to say. The one nice thing is working with Aspen, I do my own treatment plans. There's no one in corporate. There's no one telling me how to do my job. There's no one telling me I'm not doing enough crowns, not doing enough dentures, nothing like that. At the end of the day, we're doing what's best for the patient. And I like that a lot. And that's pretty much what he said, everything.
You pretty much just answered the follow-up question that I had, which was, do you guys have quotas that you need to meet? So, I mean, is there anything you want to add to that on, do you have quotas in the practice, Dr. Zarek?
No, I mean, that's the one nice thing I really like is no one is saying you're not doing enough dentures, you're not doing enough fillings or anything like that. At the end of the day, it is a business. And of course you want to produce, but at the end of the day, I'm just doing what's right by the patient. And so I never feel any sort of pressure by not meeting a quota or anything like that.
Anything to add, Dr. Vayon?
No, like we get that question all the time, and no, there's no quotas. You do what's best for the patient. There's no one to say, you didn't do this many crowns, you didn't do this many, whatever. It's like, as long as you're doing what's good for the patient, like you will never go wrong. So.
Yeah, I think that's definitely one of the biggest misconceptions that you'll hear. Or at least, again, it's one of the questions that I get all the time in my presentations. And I'm always like, no, there's no quotas. I definitely like when people ask it though, because I do like to address it head on. So thank you to whoever asked that. So we'll move on here to how do you go about scheduling in your practice? So do you guys make the schedule, or I guess how much autonomy do you have over your schedule? Dr. Zarek, do you want to take that?
Yeah. So I'm an MCD at my office. So that means that I'm the managing doctor. I don't own anything, but I'm only doctor here. And I do have say over my schedule. It's nice because procedure wise, I can say how long I want certain things, whether it be extraction cases, crowns, you name it. And so I'm able to be very flexible with my schedule. The one thing that I don't have as much flexibility on is the new patient column. And it's nice because we have a corporate headquarters that is able to place the new patients into our column. So that's the one column that they're kind of in control of. But I would say that I have a lot of flexibility on my end. And if I know a procedure might need like a little bit more care, or a patient has a little bit more anxiety and I know I have to spend more time with them, I'll just extend the schedule so I have more time with them. So I have a lot of flexibility with my schedule and I really like that.
And I will say to add on to that, you brought up the call center. That's just opened in Chandler, Arizona. Normally I wouldn't point that out, but just because our audience is from Arizona, if you guys ever are in the Chandler area, they have a brand new Aspen Dental call center out there that's taken, it's like thousands of calls a day, filling those new patients in offices all over the country. But was there anything you wanted to add on to that, Dr. Van?
I just, for scheduling, I do rely on my team, right? So, we get to say, how much time we need for procedures. And in my office, I know, I give time. It's like, look, if we're doing a filling, this is how much time I want. If I'm doing a crown, this is how much time I want. And then you just work closely with your team to stick to that stuff. So you don't have to worry about putting people on the schedule. I know that if one of my patients calls and we had planned a crown, that when they call my office, someone's going to pick up at the front desk and they're going to say, you need a crown? Okay. They're going to schedule it for 45 minutes or whatever it is, and then it's done. So, I'm not personally responsible for all the scheduling, but my team knows my preferences and they're able to put together a schedule that works.
Mm-hmm. And I think that the big part to add on to that is, as we're talking to students, I think they really want to know that when they graduate, they're not going to be rushed, or they're going to have the say to be able to be like, I need this much time.
Yeah, you literally, if it takes you an hour and a half for an extraction, you have those patients scheduled an hour and a half. If it's, 3 minutes for a filling, it's, whatever. And those times they're gonna be long at first, but the more reps you get and the more often you do it, it might be an hour and a half for an extraction. Then it's gonna be an hour, and then it's gonna be, 30 minutes, and then you're gonna be popping teeth out without even thinking about it. So it's like, that stuff's just gonna happen naturally.
Mm-hmm. So thank you for that. And somebody also wanted to know, and I think I talked about this in the beginning a little bit with Dr. Bayon. We can talk about our compensation model a little bit. So I think Dr. Zarek, you mentioned that in your intro. That was kind of one of the things that drew you to Aspen. So do you want to talk about our compensation model?
Yeah. So the one thing that really sold me, because I had worked a job where it was strictly commission, and that's a really hard life when you're like, if the schedule falls apart and you're not getting paid, it's very stressful. And I've been through that situation myself. And with Aspen, you have a daily guarantee. You are going to get that money no matter what. If the schedule falls apart, you got it. Another thing I like too is we currently work half days on Fridays, and we get paid for a full day. So that's pretty nice too. In addition to that, how much you produce, you can get bonuses off of that, which is nice. And it's all broken down into a lot of different factors, like the expenses in the office, even some patient satisfactions, patient sats kind of come into play too. So if you're getting a lot of good positive reviews, you get a bigger chunk for a bonus to take home. But I will say, working at Aspen, I have not worried about money. I've been very happy with it, and I've been with the company for almost 4 years now, and I don't have any intentions of leaving because I've been very happy with the finances. So
awesome. Well, that makes me very happy to hear.
Yeah.
Dr. Van, anything to add about the compensation model from you?
No, so that's pretty much it, right? So you get a daily minimum, and then regardless of what you work, you're getting a minimum just for that day. So it is nice to have that safety net, right? And there's opportunities to make more based on what you produce, right? So they take the production of the office, you take the expenses out, and then there's a portion that is kind of divvied based on the profits of your office. So if you're able to run an efficient schedule and work productively, then you're going to see those benefits, and you will never fall below that safety net that you've got in the daily minimum, and that's huge.
Mm-hmm. And one thing I wanted to add to that is, some jobs where they will, if you're not making enough, they will take money from your paycheck, and Aspen will never do that. Even if you didn't, your production at the end, the safety net, if at the end of the month, they're never going to take money from your paycheck. And I've had it happen to me before, and it really stinks. And that's the one thing I love about this company too. So
Mm-hmm.
I would say definitely understand your guys' pay structure, because there are some very creative pay structures out there, right? There's really simple ones that, go on, all right, you produce this much, you get X% of that, and it's pretty straightforward. And then you're kind of up the creek if there's no production for the time being. But then you get some of those creative ones where you didn't produce X amount this much, so you owe us from next month's salary. You have to pay us back for what you didn't make to cover, what we, theoretically need you to produce to keep your, office to be in the positive. So understand the pay structure wherever you guys go, because there's some creativity out there.
Mm-hmm. Yeah, that's definitely really, really great advice. And we did have follow-up questions to that, two of them. One was, do we have a benefits package? And the other asked about our contracts. So I will have you guys answer that. I do want to say really quick that we actually, I guess, don't really use the term contracts. We like to call them letters of agreement. So I will say, Dr. Van, do you want to answer that about the benefits package and letters of agreement?
Yeah, so the benefits are great, right? So that's something you don't get many places, I would say. So you're going to have like the basics covered, like, your health insurance, vision, disability, all of that stuff that, if you choose to participate in some of those things, which you don't have to, they're offered at a fraction of what you'd have to pay, out of pocket if you're getting your own coverage and stuff like that. So you get health benefits, things of that nature. You get retirement benefits. So, there's 401k with matching, and it's good matching. So all that stuff is part of, your total compensation. So, when you're looking at jobs and you look at pay, that's one thing to consider. But then when you think of the money that you're saving on like health insurance and the money you're getting in your pocket for retirement through matches, all that stuff adds up. So those are factors that contribute. And I know there was a question earlier about just dental school debt and stuff like that. I know there's some markets out there that will do loan repayment and things like that in certain areas. So there's benefits that go beyond pay, beyond guarantees. Your total compensation is, it's pretty good. It's competitive.
Mm-hmm. Anything from you, Dr. Zark?
Yeah, pretty much everything he said. Also malpractice too. So I like that about Aspen as well.
Mm-hmm. And I'll say with the contracts or letters of agreement, so we don't have any restrictive covenants, no radius clause, anything like that. I don't know if you guys have anything to add, but my understanding is, that pretty much just includes your pay structure and your pay rate, your location, and maybe any other sign-on bonuses like relocation and anything like that. But there's nothing in there that's like you have to work 2 years or anything like that, unless maybe student loan reimbursements involved. But other than that, there's no time restrictions, anything like that within the letters of agreement. This question says, so I'm graduating this year and mentorship is extremely important to me. What is the onboarding and training process like specifically for new grads? Dr. Ban, since you're going to get an associate soon, would you like to talk about this?
All right, so let's talk about first how things have changed this year, right? Because in the past, you would have gotten on a plane and you would have flown to New York with a class full of people where you would have talked about, a bunch of stuff just with like, how to operate in the practice and stuff like that. So that has all changed. So I guess initially when you come on, you want to get to know the company culture, and you want to, figure out the daily operations. So you don't get thrown to the wolves right off the bat, right? So there's a big portion of what you do at the beginning that is just shadowing and getting an understanding for, the business, the practice, just being out of school. So that will probably happen for a good month after you're out. And then you kind of dip your toes in as you see fit. So the more comfortable you are, the more you push yourself to like get a handpiece in your hands, the quicker you're gonna, going to learn, and you're definitely eased into it, right? So that's, I think, the first portion of it. And then, like I said, there's a portion where, you know, you're being flown out to other areas, but that's different now. It's online. And if I'm not mistaken, they changed a lot of that to, you know, virtual meetings and things of that nature. So it's still there, just in a different setting.
Mm-hmm.
How was yours, Dr. Zark? What did you do when you came on?
So I started kind of like doing the whole mentor thing. So I was working with Dr. Aurora, and pretty much what you said, I was shadowing for about a month and just kind of learning the ways of schedule flow. I wasn't as comfortable with extractions. I didn't get as much experience. And so I would watch him and everything like that. And then after like a month, and I started taking on the schedule and all that and getting used to things. And I learned so much that time working with him. It was a really good experience for me. And funny turn of events, now I'm in a position where I'm mentoring a new grad too. And so it's nice because after dental school, everyone thinks they know everything, but then you kind of see a lot of things that you didn't see in dental school, and you're like, oh, I wish someone was here to kind of be over my shoulder right now. And so I'm training one right now, and just great opportunity to ask questions, kind of be a little security blanket during, stressful situations or procedures, and getting a lot of feedback, and then growing from there too. So that's the one thing I really liked about Aspen too. I wasn't thrown to the wolves. I wasn't just told to do it, and there was someone guiding me along the way, and it made me a better clinician along the way with having that mentor there.
Mm-hmm. Yeah, it's definitely, like you said, a very guided process, and also very individualized. Like, you're going to be a kind of mentor doctor, and they're going to focus on you. You're going to go over what you do well, what you can work on, and really focus on how to grow you to be the best clinician possible.
Mm-hmm.
And like you said, I like that you're not fed to the wolves. Like, it is it's a very, very guided process. They're not just going to throw you to the sharks and teach you how to swim that way. Yeah, I know new grad anxiety is real. Like when you come out of school, I think everyone's pretty nervous, but it is somebody there with you every step of the way.
Yeah.
So this says, previously you mentioned that the offices are owned by doctors. Can you elaborate on that? What percentage do the doctors actually own? Dr. Van, do you want to start off with that?
So every office is owned by a doctor, and then we talked a little about the structure where, kind of the layout of an office and the different doctors that are within. There's a percentage that the doctor will take away from the overall profit of the office. I don't know what it is, but I know there's a split between what Aspen takes and then what the doctor will take. So it depends on the productivity of the office, and then that amount minus expenses is distributed between the two parties, right? Because it's kind of a partnership. You're we talk about DSOs and the support they offer. You're doing the clinical part of everything, and then they're helping out with some of the managerial stuff. So I want to say something like a 55-45 split or something like that. But that's what it does.
That's talking about the split of the profits or the overall production of the office. As far as ownership goes, I mean, the owners own 100% of the practice.
Right.
Yeah.
Correct.
So, and then to elaborate on the 45-55 split, that would be 55 in the doctor's end, typically 45 in Aspen's end when it comes to kind of splitting the profits in the business partnership. But that percentage can also vary based on the state that you're in. I know there's different state like regulations, but as far as being an owner, you own 100% of the practice, and you are in a business partnership with Aspen Dental, like he mentioned. Do you have anything to elaborate on that, Dr. Zark?
No, I don't own anything. I'm actually the MCD, which I think is a pretty good gig. It's kind of like I act like the owner, but I don't own it. And I have an opportunity to own, and you could own multiple businesses too. So there's just so much you can do with Aspen that I really like.
Mm-hmm. Some follow-up questions were, how long does it take you to become an owner? Do you want to answer that, Dr. Zark?
It sounds pretty quick to me. I mean, I do know some grads that came out, they were owning within the first year. So, if you're really ambitious and you want to get to that point where you want to own it, you have that opportunity. If you're a little bit more like, I just kind of want to dabble a little bit here, work my way in, see what I like, what I don't like, there's that opportunity too. But ownership, it's a big possibility right away in Aspen.
Yeah, I mean, there's no one set timeline. There's no like you have to be with the network for 2 years or anything like that. You can become an owner in as quickly, I guess, as you want to. You can't come in directly as an owner. You would have to be a lead doctor or an associate first. But I mean, once you're within the network, there's no set timeline. I would say the average is maybe like 2 years. But it's been done in less than a year, even by new grads, and I mean 5 or 6 years by people. Again, that's one of those things that's dependent on your confidence level, your skill level, and location is a huge part of it as well. There are certain areas where there's more opportunities to own, and I think that's where partnerships would come into play. Do you want to add on to that, Dr. Bain, at all?
No, it's entirely dependent on your drive. So if you want to do, there's an opportunity for that, and it's out there, right? So that's information that's out there. Through our internal network, you can literally click on a link and see all the practices that are for sale or they're looking for someone to buy. So it's totally transparent and it's 100% dependent on your drive.
So we are getting a little bit closer to the end of our time here. So I have a couple questions that I wanted to make sure we get to. Someone wants to know, what is the culture and team environment like within your practice? And I love talking about culture, so I wanted to make sure we got to that one. Dr. Zarek, do you want to take that one?
Sure. I'd say our office is a lot of fun. I think we all get along very well. We like doing, stuff for people's birthdays. We like to have little potlucks in the back all the time. Halloween's coming up, so we got some themes going on. But overall, the environment's a lot of fun, and it is what you make it. Every office is going to have their fingerprint, and I don't know. We just kind of keep it a little bit lighthearted because why stress too much at work?
Dr. Van, anything from you?
Yeah, I'd say there's a company culture, there's a culture within, the region, within the office. So you can go to so many different levels. And I know in our office, it's like a family. So some of the same stuff that Dr. Zark's talking about, it's like we're a tight-knit group. We're around each other all the time. So, we do outings outside of work. We celebrate birthdays, all that type of stuff. So, I like to think we're like just a close family inside the office.
Yeah, and even though it's corporate, every office, it's kind of like private. You have your own vibe, your own style, your ways of doing things. So, it's a lot of fun.
Yeah, I always say it's kind of like a hybrid model. As a DSO, because you do have the partnership with Aspen Dental Management, but they are 100% owned by the doctors. So I kind of say it's a hybrid model between like private practice and I guess corporate, like you hear in the dental school world. But on the topic of culture, I mean, like we do so many company events, and not just within like your guys' practice. We have we have a big vibe session coming up, which is a really fun recruiting event for 4th year. So if anybody's interested in that, you guys can reach out to me and we can get you signed up. But we have, leadership conferences, annual retreats, everything like that really brings the company together and everybody within it. I mean, I think I met both of these doctors at Aspen Dental events, and that's how we got to know each other. So, and I'm on the management side. So it's everything like that. It's really awesome. It is a really, really fun place to work. The last question I want to end on here, I always do this for dental students, is what advice do you guys have for students who are graduating this year and going to be looking for jobs? Do you want to start, Dr. Zarek?
Yeah. I feel when I graduated, everyone would always make it sound like they knew exactly what they were doing. And it could almost make you feel like, I don't know exactly what I'm doing just yet. But I'd say, you know, your first couple years out of school, you're going to learn so much about what you like and what you don't like, as far as like style of business, even clinical procedures. And so, you know, you're going to find your own groove. You're going to find out, you know, things that you're like there's a lot of extractions and dentures here at Aspen. And I feel like we do a lot of reactive dentistry where patients are coming in because there's a problem. And I really like that style of dentistry. To me, I feel like it's very gratifying because we're taking care of pain and things like that. So I'd say, you know, you're going to learn a lot along the way, and what you thought you'd like out of dental school may not be something you really like. And you're eventually going to get to that point, and you're going to feel like you're slow at first. You're going to feel intimidated, but really, you know, just go with the flow and really fake it till you make it. I mean, like, the thing is, like, you're going to be scared. You're not going to know how to do certain things, or you're going to wish someone was with you, but you know, it's all about the confidence. You had the proper training, and you just gotta go with it. So you'll grow a lot. I mean, I learned a lot in 5 years, and I feel so much more confident than I did when I graduated. And I just look forward to 5 more years and see how I feel from there. So.
Awesome. And what about you, Dr. Mann?
Man, so if you were graduating, I would say like start looking at, you know, the next move right now, right? Don't procrastinate on that, because you don't want to get into a position where you're just taking a position or doing something because you have to. So start early. Ask tons of questions. So, you know, try to get the best idea of what you're getting into, whatever that might be. And then I would say finish strong in clinic, right? Because you know, this is the last time that you've got someone looking over your shoulder that you can, like, you're making the decisions after that, right? Yeah, you've got mentorship and stuff like that, but it's a totally different environment to be out in the real world versus being in school. So take advantage of, you know, what you've got left there, because, you know, this whole thing is a journey, right? Yeah, you're going to find out a lot about yourself and a lot about who you are as a dentist as time goes on, and you just got to appreciate that stuff. So take advantage of all these moments.
Mm-hmm. Yeah, I love what you said about asking a lot of questions. I mean, I think that is so important. It's the only way you're really going to find out what works best for you, whether that is private practice, Aspen Dental, another DSO, public health, anything like that. You know, that you need to ask a lot of questions and make sure that you understand the answers. I think that's a big part of it. So like you said, get started. I mean, joining like a session like this is a great start too. Just kind of see what's out there and explore your options. I think that's the best way to start. It is after 7 o'clock, so our time is just about run out here. If there are any last minute questions, please throw those in the live Q&A. I did have one more question. I asked Dr. Ban at the beginning, so I'm going to ask Dr. Zarek this. It's pretty important, and there is a right answer.
Oh God.
Forks up or bear down?
Oh, well, I
know you're not
probably want to say forks up, but I couldn't care less.
Yeah, you're not from here. I guess it's not as fun. I thought it was funny somebody asked that, but so I guess we do have a divided panel here. Well, thank you everybody for joining tonight, and thank you to Dr. Van and Dr. Zarek for being here. I can see you're both still in the office, so I appreciate you guys staying a little bit late, unless that's the home decor you have brought that. But thanks again for joining. I hope everybody enjoyed this. I know I did. I'll be following up with an email, so you guys will have all my information. If you have any more questions, you can reach out to me. I'm sure if you want to talk to either of these doctors one-on-one, they'd be happy to take a phone call with you and answer any, you know, clinical questions that you guys have. But again, thanks so much for joining, and I hope that you guys all have a wonderful evening.
Yeah.
Bye, everyone.
Good night.